My name's David Hicks, and I was born and raised here in Oklahoma. I was born and raised in Blackwell, Oklahoma, and then in high school moved to Norman, graduated from Norman High, and then went to the University of Oklahoma, finished there in 1973, got married, and my wife and I moved to New Orleans. I went to Tulane Medical School, finished medical school in 1977, did an internship in general surgery, and then did a 4-year residency at Tulane University in orthopedic surgery. And the year after my residency, I did a fellowship with a man named Henry LaRocca, who was an early spine specialist. So I spent a year with Dr. LaRocca in New Orleans, and then moved here to Tulsa in 1983. There are two basic questions that you ask when you're treating somebody. Number one, what's the problem? Why do they hurt? And two, what are we going to do about it? And our ability to understand what is causing pain has improved dramatically. A series of tests, used to be just plain x-rays and a myelogram, which is a dye test. Actually, when I was at Tulane, there was a radiologist, a neuroradiologist down there who learned or taught us how to use CT scans for the spine. That was just then coming into vogue. That would have been in the early 80s. And then in the late 80s, CT scans came in. So nowadays, our ability to figure out what's wrong with a patient has improved dramatically. And that's important because, particularly with surgeries, the most common reason that surgeries don't work well is not that they're done poorly, but it's that they're not done for exactly the right reason. Maybe there's not enough surgery, or maybe all of the problems aren't addressed. So if you want to have a successful outcome with any treatment, but particularly with surgery, it's important that you understand what the problems are and that you direct your treatment towards those problems. My name's David Hicks. I'm with Central States Orthopedics. I've practiced here in Tulsa since 1983.